If you have a lump in your neck which is cosmetically visible and sometimes causing some pressure symptoms, it can have various causes. Many of you, as soon as you see a lump, some of you are more extreme and think it's cancer. Some of you are very equivocal about it and think it's just something like a goiter or something which will go away. But let's get a more rational approach and understand what are the 4 common causes of these neck visible lumps and what should be done, what are the red flags where we have to approach a specialist immediately. Let's just talk about it. Why am I talking about it? I am Dr. Gaurav Gangwani, a board equivalent certified interventional radiologist from India, and we are one specialist who treats a lot of diseases including thyroid nodules with minimally invasive techniques, no blades, no sutures, no scalps, either through lasers or angiographies. But today we are not here to discuss the treatment part. We will discuss what are the 4 common causes of these lumps. The first and probably the one of the commonest causes is enlarged lymph nodes. Our body has a lot of channels that carry the protein and the fat which veins or blood vessels cannot because of the viscosity and the thickness. These channels are known as lymphatics, which carries this white plasma like material, milky material, right from the feet to the neck veins and eventually the heart, and take these lymphatics, this lymph from all over the body, every organ. For resting, for further transport, they do have stations intermittently known as lymph nodes, which are there in the legs, in the belly, in the chest, in the neck, everywhere. Sometimes infections in various forms can cause these lymph nodes to enlarge, traveling through the lymph naturally. And of course, other diseases also can travel through the lymph, including cancer. But yes, both of these manifest usually as a lymph node enlargement. There is an exhaustive list of other causes, but these 2 are the commonest causes of lymph node enlargement. So if you have a neck lump which is lateral relatively, I mean not exactly midline to paramidline, it's somewhere here, and it is not moving with swallowing, especially if it's firm to soft, we are almost looking at a lymph node and we are happy that it is firm, not hard, not immediately worrisome, and most likely we are looking at some infection or something. Of course, every stage is customized, personalized, every patient is customized, so this is not a generic rule but more or less. Now shifting gears and shifting to a condition which is more of a midline to paramidline lump, and the most common cause of that is thyroid nodules. Yes, our thyroid is the metabolic powerhouse of the body, produces thyroid hormones, maintains the metabolism. But sometimes degenerated cells, usually cancers are relatively less common, take the form of a nodule which is known as a thyroid nodule, also known as colloid nodules or goiter in layman language. Here, because these are non-cancerous benign nodules, usually do not cause any worrisome problem, but yeah, the aesthetic lump, cosmetic concern, the pressure symptoms sometimes because of the size of the lump and the growth are worrisome or concerning, and we need to treat them. Luckily today we can treat them with, like I said, laser-like techniques, radiofrequency or microwave ablation, or angiography-like techniques, thyroid artery embolization. But we are not going to discuss it as I permitted or promised in the beginning. What I want to tell you is that if it's a midline to paramidline lump, firm to soft, when you swallow, you see the lump moving along with the swallowing. High chances it's a thyroid lump and it's connected to the thyroid, which is great then. Of course, these clinical examinations or information cannot replace a doctor consult, medical consult and investigations, but it will give you a start to understand what's going on probably. The third, relatively less common but existential causes is congenital cyst. These are known as brachial cleft or thyroglossal cysts. They can occur midline, paramidline, and they are super soft to feel, not firm at all, not hard at all. They mostly do not move with deglutition. Yes, the thyroglossal cyst can move with deglutition or swallowing as well as with tongue protrusion. So if I just protrude my tongue out, my lump will move along with it, and that is almost a pathognomic test of this. If usually these cysts are plain simple cysts, the treatment is simple, surgeries or even today alcohol and laser ablations work for them, dependent case to case basis. The fourth and the most concerning and the last cause is cancer. Yes, if it is a thyroid cancer can occur sometimes, lymph node cancers can occur. The lymph node cancer can travel through the blood in leukemias, lymphomas, through the thyroid, through mouth cancers, through even distant cancers as a stage 4 manifestation, traveling all the way, and that's concerning. So we can't ignore all the lumps. At the same time, we don't need to panic. Luckily, cancerous lumps are less common, but at the same time, we can't ignore. Only evaluation will tell us what it is. How does a doctor evaluate these lumps if they at all occur? First, of course, a physical examination, like I said, with deglutition, with tongue protrusion, they look at all the lumps. Second, they ask you to get a sonography done. which tells us where is the location, which is the organ it's coming from. Is it an enlarged lymph node or a cyst, or it's a thyroid nodule? What is the nature of it? Does it look like benign, or there are suspicious concerning features? Most of the times we order a FNAC or a biopsy and send it for histopathological, cytological or microbiological investigations to understand the cause of the problem, as well as if we do find it's an infection, then what is the exact pathogen and which antibiotics would be best for all those testings. And finally, some cases there are ancillary tests including blood tests, scintigraphies, nuclear medicine tests, which can help us in the treatment plan and management. So I hope this video helps a lot, especially to those who can have a neck lump. Potentially they are very common. Many of us, 5% of population, global population, might see them sometime in their life. Sonographic studies, cadaver studies show lumps like thyroid nodules to be as common as 76% population sometimes. But occult small, not needing treatment. I'm not saying just because 76% population can potentially have these nodules, then everybody needs treatment. But I'm just bringing to your notice the demographics of the extent of its existence. So with this, I would like to end the video. If you want to talk about any particular part of this, whether it's a lymph node or whether you have been detected with cancer or thyroid nodules, just comment and then let's see if we can help you out. Stay safe, stay empowered.